I wonder if I can do this just real fast on a whim. Dale's in another room. He's got 7 minutes before he goes to work upstairs. And I have about 27 minutes before we leave for farm school. But I wanted to come on here and tell you that the way I eat, my life literally depends on it. My brain health, my inflammation, keeping that low, my life literally depends on it. And I did not ask anyone's permission to eat this way, to treat my several, autoimmune inflammatory conditions. I figured it out on my own after taking all of the medical advice I was always given and following all the rules and doing that. It wasn't until I had a terrible response to something I ate that it dawned on me that what I was eating my entire life was making me sick. I do eat mostly beef, butter, bacon, and eggs and salt. I first came to discover the carnivore diet after I had an inflammatory response to something I had eaten. It was the first time in my life that I finally put it together that what I ate caused a reaction. I had like a food reaction and it freaked me out. I have a long drawn out history of chronic inflammation and that presents itself as autoimmune or inflammatory responses. And I was sick and tired of these things just happening to me. I felt like they just kept happening to me, almost like it was bad luck. I've been told not millions. I've been told multiple times by multiple specialists, well, we don't really know what causes it. This is just why. And now, 20 months after eating a carnivore diet, I know what was causing all of these issues over my lifetime. And I figured it out. But I didn't figure it out overnight. It took me almost 2 years of learning and experimenting with my nutrition. So the first reason I eat a carnivore diet is because in 1998, when I was 23 years old, I had this crazy dizzy spell. Like, it is vertigo. Everything was upside down and it caused severe nausea and vomiting. I got really loud full ear. I got a migraine and it lasted for hours. The only thing that I was able to do, I laid down and I was out of commission for like 12 hours. The next day I went to a specialist, a rule out diagnosis based on my symptoms. And the diagnosis was Meniere's disease. A life-altering moment. That was my first real personal experience with chronic illness. And Meniere's disease is not very well known, especially it was not in 1998. I was 23 years old. I was the only person that anybody had ever heard of in my circle. It is much more prevalent today. I have lots of people reaching out around Meniere's disease. I followed the treatment path that is the exact same today as it was in 1998. It's been 26 years since that happened, and the treatments are exactly the same. You start out on oral steroids, maybe some type of antihistamine, maybe a supplement like riboflavin, and a diuretic, which is a water pill to flush out the inflammation. They tell you to follow basically the American Heart Association or the American Diabetes Association diet, low salt diet. What I found out years later was that if I had addressed my metabolic health, which is my insulin resistance, for me it was insulin resistance, I could have mitigated 16 years of a lot of debilitating chronic illness, because I did all of the treatments the way they told me to, and I did all the medicine and I followed all the rules, and it didn't work. The diuretic, the steroids are to lessen and eliminate the acute inflammation, that big episode, and to get that calmed down. The diuretic is to keep your body flushed. It didn't work. I took a diuretic for 16 years, every day for 16 years, throughout 2 pregnancies, every single day for my, of my life. So I did all of that. And when it didn't work, it wasn't working. I was doing all these things and it wasn't working. The next option is a shunt. It's like a pop-off valve that is an outpatient surgery. They put it in to your inner ear, one of the spots in your inner ear, the endolymphatic shunt. I did that. Did okay for a year or two. Then I would start this cycle again of dizzy spells, migraines, brain fog. When you're having a Meniere's attack, it is so debilitating, and it's very hard to relay how bad it is. But I asked someone, my friend told me, she said, there was no doubt something was wrong with you. I had people thinking that I was drunk because, I'm unsteady on my feet, and then I'm sick, even though it was the middle of the day and I was at work. But it's very debilitating, and it can be crippling, the cycle of anxiety and depression that you get into. So after I had this surgery, the first surgery, and then it stopped, it wasn't effective anymore. I even tried to have a revision, and the specialist went in there and looked, he's like, no, it looks fine. But I was still having considerable Meniere's episodes. So the next line of treatment for me was they started giving me Valium to help control really the anxiety, I guess. I don't know. Thank goodness I have a very addictive personality. Thank goodness I did not get addicted to the Valium. Thank you, God. So then they give you, meclizine, which is anti-nausea medicine. Nothing ever worked. If I looked one way, and it could happen immediately. If I went this way and then looked back, I could be dizzy. And, I started developing more symptoms. So after both of the outpatient surgeries, the next line of treatment, injections, because all the while I'm having fullness in my ears. I can't hear very well. My hearing is being damaged every single time. So by the time I was ready to have a very high dose gentamicin injection into my ear, my hearing was already very diminished, because it's a type of medicine that will damage your hearing. So my hearing was already pretty poor, like really poor. And so I said, yes, I'll do these injections. That was the next recommendation. So I did 3 rounds of injections. So the first round was 3, and you're supposed to get this floating feeling and not have dizziness, vertigo anymore. So I did pretty well for that. My second pregnancy, in my first trimester, I had a really rough pregnancy, just me. The baby was fine. She's 15 now. She's great. But I was miserable, and so I had a lot of trouble in the first trimester of my second pregnancy. So I had another round of injections. So it's 4. That time I had 4. Okay. So I did pretty well for about a year and a half, shockingly, with a toddler and an infant. And then my hormones, pregnancy, and postpartum. I did really well for a few years. But a few years later, in 2014, I got into a cycle. No, that's not true. In 2013, I started down a really cycle of, I couldn't get out of the cycle of feeling a little bit better, having a dizzy spell, being out of commission. I was older. I had young children. I had stress, all those things. And my body, I just couldn't cope as well. So I had a second set of injections, and I had 4 at that time. So that's 7. Okay. So that was in 2013. Then on January 1st of 2014, we were out to eat, and I had a sinus infection, and that was usually one of my triggers. I had constantly had sinus infections. So I got very, very, very ill during that lunch, and we had to drive all the way across town home, and I was sick as a dog, and I was so defeated and disenchanted. I felt so hopeless. I thought, I cannot live this way. And I got into a terrible cycle. It was the lowest point I had when dealing with Meniere's. And I got into a really bad cycle, and I thought, I can't live this way. So I went in and did an internet search, and I found a specialist, like a specialist, otology, an otolaryngologist. And I consulted with him, and he said, I will do the surgery on you, which is an actual surgical labyrinthectomy. I will go into there and I will drill it all out. He said, but I have 2 things to tell you. This is life altering. My hearing was already shot. I couldn't distinguish between different sounds. My brain had already relearned some things, and I could do some lip reading because I had gradually lost my hearing over 16 years. And so he said, this is not just your hearing. I was 38 years old. He's like, it's not just your hearing that will be completely gone. It's also your balance system. And he said, the second thing he told me was, you are always there is a 10% chance or a slight chance. He said 10% chance that I could develop Meniere's in my other ear. And he said, and if that happens, you have no options. You can't have your other ear done because this is your balance system and you only have one left. So it's, it'd be like having a kidney removed, that kind of thing. You can't have two kidney removals. So I'll never forget he said that. But I told him, I said, listen, I can't go. I'm insisting. I have no quality of life. It was just awful. And so he did some more tests. He did so many more tests, and he wanted to do 3 more injections. So I had a total of 10 injections. This treatment path for Meniere's is exactly the same today as it was in 1998, in 2014. You try these steps, and for me, I was treatment resistant. So I know that my inflammation started when I was in my early 20s. It's just my genetic makeup, whatever it is, because I went on to develop more autoimmune issues, more inflammatory response, inflammation. So that was disheartening. And I now know that if I eat a carnivore diet and stay away from processed food, sugar, carbs, those types of things, that my chances and my likelihood is decreased. It's much lower than if I hadn't learned all of the things I had done, that I have. If I hadn't learned all of this information about metabolic health, insulin resistance, that type of thing. I really think I was having trouble with my metabolic health at age 23. And part of it was my lifestyle, for sure. I need a carnivore diet to keep my inflammation low because I went on to present with more autoimmune or inflammation centered illnesses. I ended up developing uveitis, which is an inflammation in the eye. They could never determine the root cause. They could never determine why it happened. They did a battery of tests. I did so many tests. They did a chest x-ray to rule out tuberculosis. They did all these lab tests to rule out Lyme disease, lupus, all kinds of things. And none of my markers came back for any of those inflammatory conditions from the blood test. But they asked me if I was diabetic because uveitis is inflammation in the eye, and it is something that happens to people with type 2 diabetes. They did test me for that in 2019, but they did not counsel me on it at all. And I went back, and looked at my records, and I was pre-diabetic, but they did not consider that. So they did not say that that was indicative of my, uveitis. My uveitis went very bad. It went throughout my entire eye. They talked about injections, and it scared me to death because by that time, in 2019, I was 43 and I was significantly overweight. I was 50 pounds overweight. And, I have all these conditions, and they never even counseled me on anything. It was an emergent situation. And again, I was at a specialist. We really don't know what's causing this. Maybe it's shingles in your eye, but we didn't know. It was undetermined. It's so upsetting to be told that. We don't really know. Well, what can I do about it? Nothing. Take these eye drops for months. Like the first time it's 2 months. It took 2 months to heal. So that is another reason to keep my inflammation low. The third reason, and probably the most important reason, beside the fact that I cannot afford to lose another sense. I've already lost my hearing. I can't afford to lose my vision. So I guess in that regard, it's the most important. But The third reason I eat a carnivore diet is to keep my brain health and my mental health. So I have to keep my brain firing. I don't want to develop inflammation in my brain. That usually presents as Parkinson's, Alzheimer's, any kind of neurological issue like that. That's inflammation of the brain. And I don't want to experience that. My mental health, I noticed after 2 months of eating the carnivore diet that my extreme crippling anxiety had lessened to like considerably. I was no longer having intrusive thoughts constantly. I was no longer having the racing thoughts at night, unable to fall asleep because we couldn't talk about anything that was upsetting after dark because it would set me off and I wouldn't be able to fall asleep because what if this happens? What if this happens? And it was illogical, outlandish thoughts that I knew in my brain, I knew was unreasonable, but I couldn't get past it. So my mental health, my brain health is the third most important reason. Fourth is my hormone health. In 2005, my husband and I had been married for a couple of years and we wanted to grow our family. And I had some slight fertility issues. After experiencing some weird, random symptoms, I'd get hot hands, my heart would race. I was very emotional, which still am. And my cycle was off. I went to my doctor and she did some blood tests. Long story, but it was determined that I had autoimmune hyperthyroid called Graves' disease. Okay, so this was 7 years after my Meniere's disease diagnosis. It is very common that if you present with one autoimmune illness that you will likely develop more. And I went on to develop 4. So autoimmune Graves' disease, thyroid disease, and it was Graves' disease. The treatment that I was, the treatment that I did was a radioactive iodine, which is a pill that destroys your thyroid. You have to have your thyroid, you have to have some type of thyroid function or supplement to live. I was told, you take this, it will destroy your thyroid. You'll take a supplement for the rest of your life. You'll take another pill for the rest of your life. And at 30, I was desperate to have a baby and get on with my life. I had a plan, and it was already past. Like I said, I was 30. And she said, if you want to have a baby, you have to wait at least 6 months after you take this pill because it's radioactive iodine. And it sounds crazy, and it really is kind of crazy. I said, okay, I did it. And so what that does is I was hyper, so that my thyroid was functioning too much. I get confused, so if I misspeak on it, just take it with a grain of salt. But she's explained to me I could not get pregnant for at least 6 months. She would prefer 9, but 6 months, that would be safe for the baby because it would affect my baby's thyroid. So I took the medicine and I waited 6 months and I got pregnant almost like immediately after 6 months and so that happened. But I have to take a hormone replacement, which is synthetic, it's thyroid supplement for the rest of my life. I was 30. That I am dependent on this supplement for the rest of my life. That's upsetting because I know there are people with autoimmune. A lot of times what you hear about with thyroid, especially nowadays in what's in our society now, is Hashimoto's. Hashimoto's is the opposite, is hypothyroid, but I had hyperthyroid. So I have been on replacement supplement, thyroid supplementation since 2005. And it can be very difficult to get your dose correct. But what I found out after, just really soon, like after 4 weeks, was I noticed that, my symptoms would be hypo. And so I needed a higher dose. And so I've had to monitor my thyroid health very closely for the last 20 months because it matters. If you're hypothyroid, there's a lot of symptoms that I feel and I can tell, oh, well, this is, something's off. And it takes a lot to monitor it, but I've got it down pat. And so to be in the best health with my thyroid hormone, this way of eating is very helpful. The other thing that helps specifically with hormones is I'm in perimenopause. So all my female hormones, they get out of whack and I might start to have a few symptoms. One is flushing or hot flashes. And then the other is, sleep. In the middle of the night, I might wake up at 3. But it's hard to tell. It's hard to tease those out because thyroid hormone, all these hormones they act similarly. In my experience, this is my experience. So it can be hard to determine if I am having, hot flashes because my thyroid dose is off, or if it's like a perimenopause type thing. So I can mitigate that much better. But my hormones, for the most part, have stabilized really, really nicely, where I'm not experiencing much of those types of hormonal imbalances at all. Fifth, and very important, is my food addiction. I've had food addiction since I was really a child. I can remember thinking, that food noise, constantly obsessed with, I could be eating a meal and thinking about the next meal. And this is something I think that runs in my family. It's behavioral patterns. It's not like a genetic thing, obviously, but eating to soothe yourself, emotions, that type of thing. And my food addiction got really bad in the last 10 years and didn't realize, because food addiction is glorified in this day and age. It is celebrated, and it is, especially now, there's a lot of messaging out there about, all foods fit, you can eat anything in moderation and that kind of thing. And the one thing that healed really well was my addictive tendencies, that tendency to look outside myself for a dopamine hit. Am I happy? Am I sad? To manage my emotions. And I also did that with wine. What the carnivore diet and the high, maybe it's the high fat, maybe it's the protein and fat. I don't know what it is. But within 4 or 5 days of starting the carnivore diet, I was no longer thinking about drinking wine. And I had been drinking wine every night for a couple of years. So that was major. And I just, day 6, I was like, oh, I hadn't even thought about drinking wine. And it was very much a part of my routine and had been for years. So that was incredible to me. Now, the sugar addiction has been the hardest habit to kick. I still dream about sugar sometimes, or eating something mindlessly and thinking, oh my gosh, I didn't mean to do that. I still dream about eating sometimes, some sugar. So I think I'm having a hot flash. Sometimes when I get emotional or upset, I will have a flush. So stabilizing, so something has happened. I don't miss food. I don't have food cravings. So it's very shocking to me that by eating this way, it healed my addiction. I'm not searching for a hit. Occasionally I will have fleeting thoughts about, oh, it'd be really good to have this. Or, oh, I remember what it's like to do this. But it's usually associated with something, and then it just goes away. So that was so compelling. I did hear something that there's something about maybe being in ketosis helps with, addiction. I don't know. One of the most important things, I think that if I had known this when I was younger, if they talked about it, if any of us had known this kind of thing could help my metabolic health, I think that's a very big topic of conversation right now. It's in the news. But my metabolic health has been poor since I was in my early 20s, since I got my Meniere's disease diagnosis, because I don't know why. It's part of it, I think, is just, my genetic makeup. Part of it is whatever. It doesn't really matter why, but I've had insulin resistance. I had it from the time I was young, and I think that is the source. I know that that's the source of all of my inflammation. So by the time I started carnivore diet in January of 2023, I was pre-diabetic for sure. I had to go back in the records. I was 50 pounds, 45 to 50 pounds overweight. And, you know, my HDL, all the markers were off. They were out of range. They were too high, too low, you know, they were not good. So when I eat this way, it keeps all of those risk factors low. And that is very important to me. You do not want to be pre-diabetic. You do not want to be type 2 diabetes. You don't want to be diabetic. You don't want to be pre-diabetic. The only metabolic health marker that I didn't, the criteria, you know, I never had trouble with my blood pressure. So I never had elevated blood pressure. But all of these other things healed. So I ended up, and this brings me into the 7th benefit. No. So it addressed my pre-diabetes. I very quickly got out of that range and fell into optimal range for my A1C. You know, my pre-diabetes was gone. Within a few months, my fasting insulin was well within really good range. My fasting blood sugar was low. I never messed with the CGM. I haven't done any of that kind of thing. And so all of my markers started improving greatly. And now today, 20 months after starting the carnivore diet, and actually probably within a year, really within 12 months, I hit a healthy weight. And since then, I have lost a total of 45 pounds and I feel great. My energy is so much better. I am not always searching for, you know, something to ease my emotions. I did have a CAC, which is a calcium artery CAT scan. I had that done last year to see if I had any plaque buildup because my LDL is elevated, my total cholesterol is elevated, but I like that because that helps my brain health and my hormones. And so my CAC score was zero. And like my HDL and triglycerides are 68 and 63. I'm 49 years old. It's fantastic. So lastly, probably least importantly in the scheme of what, you know, my entire medical history that I've just laid out is my rosacea. My skin improved very, very quickly. I had right through my jaw, I had like, it might have been more hormonal. I'm not sure what it was. I think it was insulin resistance. It's almost like it looked like the darkening around your neck, which that can be a sign of prediabetes and diabetes. But it was through here on my jawline. It was really dark. And then my nose and through my cheeks. I still have, you know, redness. I'm always going to have redness to my face because I flush easily